Hello, and welcome back to Healthy Care, the channel that puts your well-being first. If you or a loved one has recently been diagnosed with HIV or AIDS, navigating this new chapter in life can be overwhelming. Today, we're here to guide you through the crucial questions to ask your doctor for a clearer understanding of your condition. So, let's dive in. Segment 1, Preparation is key. Before heading to your doctor's appointment, it's crucial to be prepared. Start by documenting your medical history, including past illnesses, surgeries, and current medications. If you can't recall every detail, jot down what you do remember. Inform your doctor about any changes since your last visit to ensure a comprehensive assessment. Segment 2, Questions about the diagnosis. Now, let's explore the questions you should consider asking your doctor during your first or subsequent appointments. Understanding your diagnosis is the first step towards managing HIV or AIDS effectively. What does it mean to have HIV? Do I have AIDS? Break down the basics of your diagnosis to grasp the nuances between HIV and AIDS. How much experience do you have treating people with HIV and AIDS? Assess your doctor's expertise to ensure you're in capable hands. How can we tell if my immune system is working and how well it's doing? Gain insights into monitoring your immune system's function and health. How do you decide which drugs I should be taking? Understand the criteria your doctor uses to tailor medication to your specific needs. How well do the medications work, and what are the common and potential side effects? Explore the efficacy and potential side effects of prescribed medications. Segment 3, Lifestyle and Well-being. Now, let's shift our focus to lifestyle and overall well-being with HIV or AIDS. Do I have to take medication if I'm feeling okay? Address the importance of consistent medication, even when symptoms are not apparent. Are there things I should change about my day-to-day life? Discover lifestyle adjustments that can positively impact your health. Can I still work out and be physically active with HIV or AIDS? Explore the possibilities of maintaining an active lifestyle while managing your condition. What signs of trouble should I be watching for? Learn about potential red flags and warning signs that require immediate attention. What can I do to prevent problems caused by HIV and opportunistic infections? Will better nutrition help? Uncover preventive measures, including the role of nutrition in supporting your immune system. Segment 4, Protecting yourself and others. As you navigate life with HIV or AIDS, it's crucial to understand how to protect yourself and those around you. How can I protect others from getting my HIV? Discuss strategies to prevent transmission and protect your loved ones. Do I need to use a condom or other barrier method if my partner is HIV positive? Address considerations for intimate relationships and protection. Segment 5, Follow-up and emotional support. Lastly, let's talk about the importance of follow-up care and emotional well-being. How often do I need to see you? When do you want me to call you, between appointments? Establish a follow-up schedule and communication plan with your healthcare provider. Who can help me deal with my feelings? Explore resources and support systems to address the emotional aspects of your journey. As you embark on this journey, remember that knowledge is your greatest ally. By asking these questions and staying informed, you're taking proactive steps towards a healthier future. If you found this video helpful, don't forget to subscribe for more insights from Healthy Care. Take care, and we'll see you in the next video.